Welcome back, ladies and gentlemen. We're now delighted to be joined over the telephone by our guest for the afternoon, Dr. Abdul Hamid Abaza, the former assistant to the former Minister of Health. Dr. Abdul Hamid, it's a very good afternoon to you, sir.
Thank you very much for calling me.
Thank you so much, Doctor, for your time this afternoon. And let me start, Doctor, by asking you a bit about the upgrading and improving of the healthcare system and the health insurance system in Egypt, which has become a priority for the Egyptian state. How do you ensure, that such sufficient available services are made available for Egyptian citizens, especially those people who most certainly need it the most, for example, the elderly or, people with special needs?
Well, I just want to start saying that this law of the medical insurance,
yes,
we consider it the law of the century, because it's going to move, not only it's going to help the people who are unable to afford the medical services, which is becoming, as you all know, very expensive, and it is increasing every day. So there must be something to stop this inflation in the medical care.
Yes.
And this is the law of the insurance, the new law of the insurance. So it was very important not only to give service to poor people or even the middle class people, but it's going to push over all the medical services given, because there is going to be real competition between the hospitals, the governmental hospitals and the private sector, which is becoming now very expanding in Egypt. And this is going to push the medical services as a whole, even the hospitals which are still not under the medical insurance.
Yes, absolutely.
So it is a law which is going to give the accreditation to the hospitals. It's going to give fair prices for the governmental hospitals to gain some money, and at the same time it is not overpaid. And it's going to create a new system in the medical services as a whole, whether the medical or the surgical or even the rare diseases such as the malignancies and the other neurological diseases.
Absolutely. Now, Dr. Abdul Hamid, we've seen, the health system financing, which has become a key instrument towards achieving the universal health insurance system. And we're seeing the World Bank and the World Health Organization have both been providing this new system through technical and financial support, since the beginning of the bill's implementation. How crucial is the support of international institutions in achieving universal health care, in your opinion?
Well, it is very important, and I think it's mandatory.
Yes.
And when we did this law, we studied this law with 11 countries in a sort of seminars and meetings, and we discussed all this thing with the World Bank and with the WHO. Of course, they were represented in every meeting. And it took a hell of effort to put them as partners in creating the financial position of this law, because we did a feasibility study, and actually we did 4 feasibility studies. 3 of them were refused because there were overpayment from the people,
right.
And the 4th one, which is taken, all these parts or all these groups were involved in the medical supply of the money, and to continue pouring this amount of money, because it's very important, as of course you know that our budget in Egypt cannot tolerate, not only in Egypt, I want to tell you, even in the United States, even in England, even in Mexico, even Turkey, all the countries which created this law are still lagging behind, because the financial things are very, as I told you, very expensive, very expensive.
Absolutely.
So these groups with the JICA from the Japan, from Holland, from England, from all other countries, are supporting this law, because they understand that this too is mandatory to Egypt.
Indeed. And now, Dr. Abdul Hamid, of course, achieving equality and equity and health outcomes is a challenge and is the main goal, really. How do you ensure that the quality and standards of the healthcare system are upheld under such a system?
Well, we did a sort of checklist, and the group of the accreditation, actually they are experts, and they are very meticulous in their work, and so they don't give accreditation to hospitals like it was before. Before, there was certain rules which were very simple for a hospital to take accreditation. But now it's becoming very difficult. There is a very big and huge checklist which should be fulfilled. And so I am sure that, and I think all the group working now in the field of application are sure that when the group of accreditation gives an accreditation to a certain hospital, it is definitely accredited with a high level of medical service.
Absolutely. I'd like to thank you very, very much, Dr. Abdul Hamid Abaza, the former assistant to the former Minister of Health. Thank you so much, sir, for your time and your insight, and for joining us this afternoon on today's episode of Cairo Local Time. Ladies and gentlemen, we go to a short break and we'll be back for more. Do stay tuned.